8 years old man falls on the back of the hand on X-ray. He has a fracture in the distal radius, demonstrating the volar displacement of the fracture. What eponymous term is used to describe the that means what is the diagnosis? A person who suddenly fall on the back and distal radial demonstration, that is the volar displacement. So this is very important. This is the volar displacement. What is the name of the fracture? Here the options are Barton fracture, Collis fracture, Smith fracture, Potts fracture, Galeazzi fracture. So first of all, let's see, this is a Smith fracture, which is also known as the reverse Collis fracture. And what occurs in Smith's fracture or reverse Collis fracture? It is the volar angulation. This is very important. This is the volar angulation. This is the volar angulation of distal radius fragment, and it also known as the garden spade deformity, because the garden spade look like this, and it is caused by falling backward onto the palm in a outstretched hand. So all time outstretched hand, falling on outstretched hand is a dangerous thing, because the different type of fracture they are present, including the scaphoid fracture, which is a dangerous fracture. So any type of fracture around the wrist joint, in the lower part of the radius and ulna and wrist region, especially the scaphoid fracture, they all are due to the falling on outstretched hand. So outstretched hand falling, it is a dangerous thing, and different type of the fracture may occur, or falling on the wrist flexed. So the Smith fracture, it is the volar angulation, and it also known as the garden spade deformity. This is the volar displacement. There they are volar angulation. Here we can see this is the volar angulation, and in this situation the hand which goes inside or inward, and this is the fracture known as the Smith fracture. And this picture showing two important fracture. One is the Collis and another one is the Smith's. In case of Collis fracture, here we can see the fracture segment or the hand, it is going outward. So this is the key point. That means in case of the Collis fracture, the fracture segment goes outward. On the other hand, in case of Smith fracture, what occurs? In case of Smith fracture, there is the inward movement of the distal fragment or hand, and it is the volar displacement or volar angulation. So what is the diagnosis? I think it is very clear. It is the Smith's fracture. So distal radius, there is the two important fracture. One is the Collis and another one is the Smith's. But when there is the volar displacement, that means the distal segment inward, then it is called Smith fracture. But when the distal fragment goes outwards, in this area, this is called the Collis fracture. So it is about the Collis and Smith fracture, and it occurs due to falling on outstretched hand.